Tonight, a record-breaking number of children to report in the hospital with COVID infections, and doctors believe that number is going to continue to go up. One local hospital opened their doors to us tonight to give us a little peek inside. Brooke Katz's here to share their insight and, honestly, what they expect to come.
And Doug, Children's Health says by no means are we at the peak of this Omicron surge. They have concerns about the numbers of kids they'll be seeing, as well as concerns about keeping their staff healthy and safe.
As the Omicron variant grips North Texas, Children's Health is getting prepared for what's ahead.
We should anticipate that over the next several weeks, we're going to continue to see a pretty steep increase in the number of cases. That's going to mean a steep increase in the number of hospitalizations.
Dr. Jeffrey Kahn is the director of infectious disease. His prediction comes as we're already breaking records. According to the DFW Hospital Council, there are 125 pediatric COVID patients in area hospitals. That tops the previous high of 111.
Essentially, all these cases fall into one or two categories. One is that the individual has not been vaccinated, and it could be that they're just too young to be vaccinated. We've seen a lot of infants with COVID. The other bucket, of course, are those kids who are on immunosuppressive therapy or transplant recipients, and they probably can't respond to a vaccine.
And it's not just the patients Dr. Kahn is worried about.
My fear is that this is going to be a double whammy, if you will, because we'll have a large surge of patients coming in. Yet some of our staff won't be able to work because they've contracted COVID, and that's a pretty scary scenario.
He says the best line of defense remains the vaccine.
I have been speaking with parents of children who are not vaccinated who are in the ICU, and I think a lot of those parents regret the decision not to get their children vaccinated. Standing at a bedside of your child in the ICU on a ventilator, knowing that this could have been prevented.
If you do have a young child at home who's not eligible for a vaccine or a child who's immunocompromised, Dr. Kahn says the best safety net is to make sure those around them are vaccinated. And when going out, know the safety measures being taken at the places you're going. Use your judgment on whether or not you're comfortable with those. Doug?
All makes sense. Brooke, thank you so very much.